Welcome back. This is Maggie, and I am your trainer for the number 6, lesson 6 in the new supervisor training. We talked about in the previous lessons about taking your self-assessment to see if you have what it takes to be a supervisor, because there are specific skill set like time management that are necessary in order for you to succeed in your role. And the purpose of the series and the class that's being developed is to really equip you with the skills that you need. Hopefully, you have a certain amount of discipline and time management. But if you're totally frazzled and you don't have any concept of time management, that was one item on the self-assessment tool. So in terms of time management, remember, in the organizational chart, you have the CEO that sets the vision. And of course, in long-term care, we have corporate offices. Everything comes down the pike. And we don't usually have a lot of input into what's developed and how the processes are developed. So we just get to implement them. And as a supervisor, that's what you do. Your job is to implement the policies and to make sure your team, your staff are following the rules with the goal of providing excellent care to your patient and in their growth and their comfort, so that they come out satisfied with the services. And of course, right now we are dealing with a lot of issues. We are stretched in terms of staffing. There's a lot of turnover. There's a lot of dissatisfaction. So we have like a multi-pronged problem we need to address. So if you are a supervisor in these times, you are going to be challenged. Remember, I am focusing on the soft skills. I'm not going to teach you how to learn the system that they use, the point of care system they use. That's not what these classes are about. I'm trying to teach you the soft skill, those things that they don't even address, in an orientation. So how do you develop good time management? Okay. I remember as a supervisor, when you get to the floor, hopefully you get report. You know what's been going on. And if you don't get report, you ask, okay? You find the DON or a supervisor. If they don't, you just go around, you ask the nurses, how are your patient? Did anything happen? Did anybody have a fall? Any complaints? Did you have to call the doctor? Any abnormal labs, tests? Did you send anybody to the hospital? Right? So my dog is just making noise. I apologize. So if you can get there like 15 minutes early, that's even better. That kind of gives you a heads up, right? So you gather that information. You know if a patient is unstable. You know if somebody has a complaint. You know if somebody has abnormal labs. Let's say I put a call into the physician. I'm waiting for the doctor to call back. You talk about your staffing. Let's say you short staff. As a supervisor, that is your job to kind of divvy up the duties so that your patients can be taken care of. Because you want your patients to be taken care of, but you don't want to piss up your staff too much. You want to make sure they get to a point where they can work together. And that in itself is a challenge. Some places have a scheduler. I always feel like it works better for me when I have one CNA who maybe has been around the longest and who gets along with the rest of the staff, and kind of put her in charge of getting them together and making sure that whatever the scheduled assignment comes out to, they're okay with it, right? So if you're short, sometimes you're told to send somebody to another unit. Sometimes you may have a floater. So you can, as a supervisor, be creative. If you're short, you may want to team up your CNAs so that they can work together and not like, this is my section, this is my section. I find that if they work together, they can get a lot more done. And then you say, if they're short, you say, don't worry, I'm going to be right here. I'll be helping you. I'm going to help answer lights, blah, blah, blah. You can be creative, okay? The idea is you want your patients to be safe, and if you want your staff to be relatively happy, right? So once you finish getting your report, what I usually do is that I go around, I make rounds, okay? If you tell me Mrs. So-and-so is unstable, I'm waiting for the doctor to call, that's number one on my list. I'm going to go assess Mrs. So-and-so, see for myself what's going on, and then decisions are made based on my assessment and the finding. If the patient is kind of stable, it's not that bad, I can go make rounds. But if it's somebody unstable enough to warrant being sent out, that's where I go. That's the prioritizing part. You don't just say, oh, I got to go make my rounds first and then go assess Mrs. Jones. What if Mrs. Jones gets worse? Then you end up with a code. A lot of things you want to be proactive to prevent further complications, right? If they say Mr. So-and-so has been unhappy about whatever, and his wife is in the room, and they're waiting to talk to you, again, you want to go nip it in the bud, go take care of it, do what you need to do to resolve the issue. All right. So if none of those things are happening, I go and I make rounds, okay? I go to all the unit, I enter every single room, I introduce myself, and as I'm making rounds, I'm trying to provide some level of comfort. If the patient is needing water, I can take care. I don't have to call a CNA to go get some water. The CNAs get upset when that happens, and with good reason, you know. If they're taking their vitals and somebody needs a cup of water, I don't want to go flag a CNA to say, can you get a cup of water for so-and-so? I get mad, and I would get mad too. You know, I would get the temperature when it needs to be. One of the things I tell the CNAs when you make rounds is declutter. You know, a lot of times the rooms have so much stuff. We need to make sure that we position like chairs and tables and stuff to reduce the risk of them, you know, getting entangled and falling. If you see anything on the floor like water, grab a towel and get rid of it. You have to call the maintenance for that. So again, I am trying to provide a level of comfort as I'm making rounds. I'll answer a call light or two. I would provide information. Say your CNA is coming. If somebody says I need to be changed, if it's something that, you know, can wait until the CNA gets there, that's it. Again, I think people appreciate the communication. They appreciate not being ignored. Two things I find that patients or residents get upset about. If they put their call light, no one answers the light. That's number one. They get upset. And I need to find out what's the average time somebody is willing to wait. I bet you it's not long. Because everybody expects somebody to show up right then once they put the light on, right? If you say you're going to come back, this is something that they complain about a lot. If a CNA or somebody answers the call light, like someone like me, say, oh, I'll get your CNA. And those who walk in the season, they say, oh, yeah. Everybody says that, and nobody shows up. Number two, if you promise you're going to come back, make sure you come back within a reasonable amount of time, okay? And depending on what they want. If they want a cup of water and you're busy doing something more important, that can wait. But if they say, I need the bedpan, and you say, I'll be back, or I'll get somebody, and it's like 30 minutes to 45 minutes, you can see how that could be a problem. All right, so I make rounds. As I'm making rounds, I'm introducing myself, telling patients who I am, telling them I'm there if they have any question, anything that is not resolved with their nurse or CNA. That gives them a level of comfort. I'll tell you a story. I used to supervise on the weekend, Saturday and Sunday. I do double shift, 16 hours. And that Saturday, Sunday night usually is a little bit short. So one day I walked in, and the dining room was close to the front entrance. And then usually when I'm coming in at like 6:45, some people are lined up against the wall waiting for the dining room to open. Well, you know, they don't have a whole lot to do. So going to breakfast is usually a big thing. So I remember this one person, he was in a scooter. I think he had some kind of surgery or inability to walk. So he was a large man and he was in his chair. So I'm like, good morning, good morning. And he said, oh, you're on today. I said, yes, how are you? He said, oh, I'm glad you're on. And I'm like, really? How sweet. He said, yeah, we feel safe when you're here. That was the best compliment he could have given me. For somebody to say, I feel safe when you're here, is the highest compliment a patient can give you, right? So we need to convey that sense of calm and safety for the patient so that when they see you, they said, oh, she's going to take care of me. If I have a problem, I know who to call. Just like you tell your nurses who you are so they know to find you. They know where I sit. They can usually find me. You want your patients to know the same thing. So how do you prioritize? Again, if a patient needs something urgent, they have a normal lab, they're on the verge of going to the hospital, you address that number one. If there's a complaint about a family member, I would say number two, okay? So you go and you look at every patient, you put your eye on every patient, and if hopefully you have a photographic memory, you can remember what they look like. You could say, oh, this patient, you go to the nurse, this patient looked like he was short of breath. I'd like for you to assess him first and see what's going on, okay? Because you are the expert clinician. You are supposed to be comfortable with managing anything that could happen with those patients, and you are supposed to be the backup support for that nurse. If that nurse is uncomfortable, if she's new, she's not sure, she needs to know who to come to, okay? So you prioritize those problems first, okay? Abnormal labs need to be called to the physician. If a patient is going downhill, I always told my nurses, if a patient is going bad, you call me. You have my number, call me, send me a text. If I don't respond, it's okay to page me overhead. So I go, I assess, I concur, we call 911. Because sometimes the nurses are a little bit skittish about calling EMS, but once I do my assessment, I have no problem doing it for them or with them. Okay? So I have a form that I used when I was supervising. I had my priority things on top, meaning return calls, assess patient, abnormal lab, somebody who had a fall, any kind of incident. You address those first, right? Then you go on the computer, you look at your system, you see what else needs to be done. Skin checks, quarterlies, stuff like that. You put that number two. You go in the system, whatever system you're using. A lot of people are using PCC right now, and you could see what is due, what's coming up. So your goal too is to make sure that the facility is in compliance. So if you see anything is past due, I used to get nurses telling me, well, I didn't work that day. That is not my job. I'm not going to be doing it. Yeah, I would do it. So as a supervisor, you want to keep your unit and your facility in compliance, okay? Any kind of report that you're supposed to do, because many times you have things that are designated for you to do. Let me see if I remember some of the stuff I was supposed to do. In addition to skin check, follow up with falls, making sure they get their assessments, any kind of complaints, you need to write it up to make sure you give report to the oncoming staff, and things that you have to notify your manager, any AMAs, if you're calling DCF. Let's say the state walks in, that's a whole different ball game, okay? So you want to make sure you have your ducks in a row, and then you do the same thing when you're doing the handoff to the next unit. That way they don't come in blindsided. You want to let them know what's been going on, how your day went, how your shift went. So next time we'll talk about communication and also how you supervise and coach your staff, because there's a style to do that with the best results and efficiencies. So I hope you enjoyed this class, and of course my class is going to come. It's going to have a whole lot more. Thank you for tuning in. See you later.